While awareness around mental health has grown in recent years, many men still struggle to seek help. Studies show men are less likely to access services and more likely to suffer in silence.
So joining us today to talk about some of the biggest myths around men's mental health, we have Dr. Jody Ryan, Vice President and Medical Director at WellPower. Jody, thanks for coming in. We really appreciate you being here.
Yeah, thank you.
We talk a lot on the show about issues affecting women, but many of us women have men in our life who we love, and we want to take care of their heads and their hearts, right? Why is this, where are we even starting with this conversation on why is it so hard to get guys to think about doing this, taking care of themselves?
Well, I think that there's a lot of myths with men and mental illness, and I think one of them is that mental health challenges don't happen as commonly in men compared to women, and that's patently false. You know, men experience depression, they experience anxiety, stress, substance use issues, like anyone else, and their symptoms may look different compared to women. Men may not be sad, but they may be more angry, irritable. They may be more isolative. They may be plowing themselves into their work or using substances as a means of coping. And so men are different in that regard. And when you look at suicide rates across the country, it's predominantly in men, 80%. And that's like a staggering stat, which is gobsmacking and really underscores the importance of having a men's mental health month.
That is a staggering statistic. I'm glad you stated that. When it comes to myths, you know, something that I hear a lot, and it only aids to the stigma here, is that it's a weakness for men to seek mental health help.
Yeah.
What would you say?
Well, as a man and as a psychiatrist, I think that if you sense something is going on, seeking help is a strength. You know, if, and when you look at the data, so you're right, like men tend not to seek mental health care like significantly less compared to women. And I think that we teach men and young boys, right, that it's important to be independent, it's important to figure things out for yourselves, pick yourself up by your bootstraps, right? And all of those messages really, I think, handicap men. And so I would say that taking action is a strength.
One of the things you mentioned right off the top was in all the columns of problems folks might be dealing with, loneliness.
Yeah.
And I want to understand more about what that means and how it ties to men's issues.
Yeah, and I would say that all of us here are vulnerable to experiencing loneliness.
Sure.
And, you know, in 2023, the Surgeon General identified loneliness as a national public health epidemic. And I think that things have only gotten worse. And when you look at men today and the relationships compared to previous generations, men today have less connections. And you know, we're wired to connect with others. And so I think that it's really important that men, in particular, be mindful of those connections, and because they are part of your overall health.
Yeah, well said. Another myth, you know, I'll hear my husband or his friends, you know, oh, you've had a rough day, here, have a drink, you know, take a load off, relax. What would you say to that?
You know what? It works in the moment, right? Like it's an escape, right? It helps people forget about their problems. And the challenge with that is that, you know, it tends to creep up and become a daily thing. And data has shown that that leads to more depression and more anxiety. And so coming back to data, when people use less is more, whether it be alcohol or cannabis, people have less anxiety and depression.
That's a lot of self-medication talk. There's also, you know, other ways people can seek help. They can look for a service like those that you offer, you know, connecting with a therapist of any kind. Yes, at WellPower. And, you know, on the more serious, perhaps urgent, that we always talk about offering the 988 line as well. And I want to we're running out of time on this interview, but I want to make sure we put that in front of folks one more time so they can see that and talk about, like, there are so many people who want to help.
Yes.
Always.
Yes, and taking action is a strength. I just want to underscore that, especially for men.
Yeah. Okay. So one more time, we'll say 988 is Colorado's mental health line. Again, you can call in those. We also have walk-in centers. There's so many options.
WellPower.
Let's send folks off with kind of that list of options.
Yes.
And talk to a friend, talk to a family member, talk to a trusted provider, right? And again, WellPower, we're here to help, and we're here to help people in their mental health journey.
Dr. Ryan, thank you. What an important conversation. Thank you so much.
Thank you for having me.